DJ. Hi, Crystal. Chuck and Linda. Deb. Welcome, everyone. Hi, Cammie. Read AI meeting notes is in. I don't know if that's a real person. Hi, Deb. Hi, everybody. Welcome in. We're admitting everyone for our session of Life Amplified, our surprise session. We're going to get to that in a moment. But as we're getting started, because it's 2 o'clock on the Eastern time zone here on a Wednesday, which means, hi, Kim, that it is another time to get together for our session of Life Amplified. Hello. Crystal's already getting started. You know what I like? I like engagement in the comments. Thank you, Crystal, for getting us started. Hi, John. Hi, everyone. Welcome. We know we got about half of our people today, and that's completely fine because many folks are at the Amputee Coalition Conference in Vegas this week. Yay to all of them. We hope that they could watch our recording, and to all of you who are watching our recording, we miss you. We'll see you next week with Coach Jake. We'll talk more about that at the end of the webinar. But for those of you who could make it, thank you for joining us and spending your time with us this Wednesday for the next hour. And as always, we will watch the waiting room. Some folks join us later if they're sneaking in a break from work or they're coming off of another group. So we'll see some folks popping in as we go along. Kim knew exactly where I was going, and she already put in there, Indiana. Yes. Thank you, Kim. So hi, everyone. For those of you watching our recordings who are new, or if you're new joining us live, I'm Jennifer. I'm the Executive Director for Amputee Aid. This is Emily. Emily is a social worker for Amputee Aid, and Amputee Aid sponsors Life Amplified. Life Amplified is a weekly webinar where we get together, we learn, we chat, we share ideas. Sometimes we have guest speakers. Sometimes we just have fun. We always like to know where you are coming in from. Washington, Texas, Indiana. I know we've got some Arizona folks in the house. If you're comfortable sharing in the comments where you're from, only folks live will see the comments. We are recording our webinar, and we're on TikTok live as well, recording there. Know that we, Emily and I, and Lucho behind the screen, we can see your lovely faces or your names or your profile pictures. The recording does capture your voice. So when we post our webinars to YouTube every Friday and share them with our group of over 1,000 people now, the recording will show us in our studio here for Life Amplified. It will not show your face, but it will capture your voice. This is an engaging topic today. We'll talk about that in a moment. But just know, if you're the kind of person who's like, not really sure I want my voice on the internet, that's okay. Put your comments in. Crystal, Emily says, hi, Crystal. Put your comments in. We'll read them as we go along. But you can also just come off of mute, interrupt us at any time, and we'd love to hear from you live, but your voice would be captured on the recording. Okay, so so that's step one. Who are we? What are we doing here today? And who are the two of us? Second kind of housekeeping thing before we get started is you might have noticed when you logged in, and if you don't, you will next week, some guidelines. We are going to be introducing guidelines for our webinar, and that is not to deter anyone from attending. It's just to set some expectations for how we will engage with each other and how we would like all of you to engage with each other as well. We'll be sharing these guidelines when we send our recording out on Friday, and then you will see them kind of posted going forward in all of our webinars in the chat. Okay, we're going to figure out the text so that we can have them as part of our registration packet. So these are real simple guidelines, I think, but they're super important, which is we want folks to be respectful of each other and then respectful of us. If you have super personal, detailed information, this might not be the time to discuss it in an open forum or on a recording, right? We want to hear from you. We want you to share as much information as you're willing to share, but just know that our recordings go out to over 1,000 people every Friday, and at some point, maybe millions of people online, if I have my way, and we get we become YouTube and TikTok influencers. I don't know. We're not there yet, but we might be in the future. So it might not be the time to talk about super personal medical information, or certainly not a time to use select language, I would say, using my grandma's phrase, or curse words or those kinds of things, or things that might not be commonly used, right? So we don't want to deter anyone from participating, but please be mindful and respectful of each other. That's what the guidelines are all about. Now, that being said, if you have very personal medical information, very specific questions that you want to have asked, that's what we're here for. Okay, connect with us. If you are already a client, you can email or text us at any time. We're going to get back to you the same day. That's our policy here at Amputee Aid. If you're not currently connecting with us, just go to our website, amputee-aid.com. click the little blue Get Help button at the top, and you will connect directly with Emily and with me, and we can talk to you about those very personal things. So to summarize, we are not discouraging anyone from participating. We don't want you to shy away from sharing your information, but be mindful that we are recording our webinars and we want to be respectful of everyone's space here. This is a safe space, to use a term that Emily used, I think last week or the week before.
Yeah.
So, Dean, and please use the comments. We'll read as many comments as we can, and Luto will help us as well behind the screen. How about a Carl update? Carl is still recovering from his osseointegration surgery. I expect to do an interview with him so that we can give you more details. I have a hard and fast rule not to talk about people when they're not present. I'm sure you understand that. And also, I don't want to screw it up. But some of you might have recalled, if you've been with us for a while, Carl had osseointegration surgery, and he then had a bout of tendonitis and some very serious infections that have to be cleared up. So it is not, I will say this on his behalf because I already know this from him. He does not regret having the surgery. We overestimated how quickly he would recover. And I expect to have an interview with him so that we can share all that information with you. So thank you for asking that, Dean. I will let him know that you asked. And I'm looking forward to him returning and sharing insight with us. For now, you got the two old girls, okay? You got me and you got Emily, and you had to put up with us. And we will, in the future, have more guest speakers with lived experience so that you can hear from folks who are similarly situated to you. Kim, for example, who's with us often, has already volunteered to be a guest speaker and will be coming up soon, because we think it's super important that you hear from folks within your community as opposed to us who are supporters of your community or who have family members with lived experience. So stay tuned. Carl will be back. In the meantime, you get us, and I hope that we're a good second or third choice at least.
Yes.
So let's talk about today. Now, if you registered or dialed in expecting to hear about 3D printing of prosthetics, you're in the right place, but we're not having that conversation today, I'm sorry to say. And I want to be respectful of Prosthetics Plus. They are generous to us. They gave us their time. There's some snafus with the scheduling of their guest speaker, so that will be a later conversation we will have. We will advertise well in advance of when that date is so that you can hear from them or someone who also does 3D printing about that option and for some people how it might be more affordable for their prosthetics. We learned this on Monday, so we put together another topic for today that we hope will be helpful to all of you. But at a minimum, if you stick around, you will be entered into a drawing. Everybody knows I love giveaways, right? Mm-hmm. And today, we are going to draw a name at the end for someone to get a $50 Walmart electronic gift card. So if you got a Walmart in your area, you can use it. If you don't, order something from Walmart online. Y'all, I had to sit through a very boring webinar to get that $50 gift card to give away to all of you. Who remembers? Let me see some hands up, some emojis. Back when timeshares were a big thing and you could get a free vacation if you sat through the timeshare. It was kind of like that. I had to sit through an hour of a product demonstration for something we will never ever use at Amputee Aid, but I got the $50 Walmart gift card to give. I see hearts going up.
Yep.
To give to all of you. So stick around, and Lucho is taking your names, and we'll draw that winner at the end. We're going to be doing more giveaways as we go along, in part because we think it's fun, but we also want to get, hopefully you get a benefit from just listening to our webinars, but also you get a little fun thing here and there. So can't promise it every time, but this time, as part of our theme, which is how to get free stuff, we are going to be giving away our $50 Walmart gift card. So if you're with us live, please remember, we will have, and Lucho, we can start our PowerPoint presentation. We're going to talk to you all about how to get free stuff. Okay. If you're watching the recording, please watch all of the recording, because near the end, we're going to ask our attendees live what tips you might have for getting free stuff. And this is somewhat tongue-in-cheek. I realize free stuff might not be the most professional way of titling a presentation, but we think it makes the point, which is that we want to talk with you all from our perspective as nonprofit folks, social workers, and people who are professional fundraisers and professional getters of free stuff. That would be me and Emily, about how you can get free stuff as well, whether it's an item, services, how to manage your finances, how to partner with nonprofits. So we're going to be talking about all of those things here today. We created a PowerPoint just to kind of keep our thoughts organized and for something for y'all to look at that's not just us and our pretty set and the pretty host and co-host, I would say. Could I hear from someone if you can see the PowerPoint? Because we can't see you or your comments. I think Lucho, you can probably see them. And then am I seeing is Lucho seeing any thumbs up that you can see our PowerPoint as we go along? We're seeing, okay, Lucho's saying yes, so I hope that is the case. For those of you who have been with us for a while, you know we are not immune to tech difficulties, and so hopefully I'm not jinxing it by asking if you can see the PowerPoint. But we can see it. Okay, we don't want to jinx Lucho behind the screen. Okay, we trust, all of our trust and faith is in Lucho. All right, but if you do have comments or if you want to chat, Lucho will let us know, or just literally come off of mute and interrupt us mid-sentence if you have to with any questions, comments, or other tips as we go along. So are you good with that, Emily?
Mm-hmm.
Okay.
Yeah.
So Emily, why is this topic important for folks with limb loss or limb difference?
So there's a couple reasons why free stuff, free services, free items can be a good idea. So first of all, it saves money, living on a fixed income, inflation, everything going up, but our pay, it's a way to get some things for free that don't give you financial strain. It increases access. So when people are giving free stuff, not necessarily services, but free stuff, everyone can get it. Doesn't matter how much money you make. You could make $100, you can make $1 million. It doesn't matter. They're giving away the free item. So it makes it more inclusive for everybody, and everyone can benefit from it. It removes barriers, kind of like that same thing. Whereas normally if you wouldn't be able to get it because you made too much money, right? Well, it doesn't matter in this case. Mm-hmm. It supports smarter choices. It could let you try a product before you, to make sure that you like it before you buy it. So it can kind of be, it can lead you to make smarter choices about if something is for you or not for you. And it also reduces stress because it's free, so it doesn't give any financial strain. And so I think the key takeaway is that it empowers people, and it makes everything inclusive. So.
Yeah, these are such great points. So we have some slogans, again, somewhat tongue-in-cheek, but I think that they're helpful. Yours is
free is for me.
Yes, mine is free dollars. I love free dollars, or free 99.
Yes.
But I think you're making a larger point here, which is that, yes, free is good, right? Mm-hmm. But we also want to be mindful that a saving somewhere means you are opening resources somewhere else,
exactly.
Right? So some of the tips we're going to talk about are where do you literally get something for free 99 or free dollars? Where is free for you? But other tips that we're going to be talking about are where are there opportunities for savings somewhere so that you are freeing up your resources for an expense that you might actually have to budget for or actually pay. So it's a combination of nonprofit services, foundations, grants, GoFundMe, where can you get a free sample, those kinds of things. So it's I would not say hodgepodge in a bad way, but it's a combination of different options for anyone, even folks not in the limb loss and limb difference community, about free stuff.
Yeah.
So let's start with tip number 1. And again, y'all, as we're going along, if you have questions or if you want to come off of mute, please do. Lucho, can we go to the next screen for us, please? All right. Lucho's driving the PowerPoint for us. And so thank you very much for that. Okay. Tip 1, working with nonprofits and foundations. All right. So first thing I want you all to know, Amplitude Magazine. If you go on to Amplitude Magazine, which is online, and Kim actually writes for Amplitude Magazine some of the time, so you'll see her articles, but they have a database, a free database that you can search all the nonprofits and foundations that are available to you, whether you have a specific need like a running blade or a geographical need. Maybe you're looking for support groups in Ohio. We're on there. We're one of many, many, many resources on Amplitude Magazine's database. So first tip is if you're looking for, well, how do I find a nonprofit or a foundation or someone or an entity that might work with me, start there. There are descriptions based on location and types of service. Now, sometimes those things change. It's not Amplitude Magazine's fault. People change their contact information or the type of services they provide, but it's a really good start is focusing on this kind of a database as opposed to just a blanket Google search. Google is good too, but you'll get a lot of different results, right, Emily?
Yeah,
and
which
Google.
could be scams or just more advertisement. They want you to click on their thing, but it really doesn't have anything to do with what you're.
Exactly.
Yeah.
Yes. So, some of this conversation on tip 1 is pulling back the curtain to tell you about how we operate as nonprofits. I can tell you for fact, for example, if you go to ChatGPT, you'll see Amputee Aid a lot. And that's because, not that we use it for our work, we don't, but we have learned that if you put the name Amputee Aid in there, it'll show up. Okay, so letting y'all know, because Carl's not here to stop me. So don't chat GPT necessarily or Google, but start with a database that is specific to folks with limb loss and limb difference. So couple of tips for it. So how does this mean getting free stuff? Well, one thing, for example, is nonprofits can and should work for you for free, right, Emily?
Yeah.
Yeah. So if you ever find a nonprofit that is asking you to pay them money for their services, yeet yourself. Go in the other direction. Okay. We are 501c3 organizations. Some of us have a different tax designation. We're here to work for you at no cost. Couple of exceptions. Number 1, you might have a fee for service as part of that nonprofit, right? So, for example, if a nonprofit provides mental health services, they might ask you if you have insurance because there's a billable component to that, right? So that's an example of what's called a fee for service for the nonprofit to do its operations. But simply to become a client, there is no cost for that, right? And Emily, there are a lot of things that nonprofits can do, right, as a client of them. So what kinds of things can nonprofits do for you for free?
So it's just honestly a support system, someone to talk to, someone to help you navigate the healthcare part of it, navigating with insurance and healthcare and things like that. All that's free. So support, assistance, just myself taking the burden off of someone else to look something up. So to type of ease stress, but to find resources for you, can even contact those resources for you.
Yeah. So here's a good example. If you are in the market for a new apartment and you would like to know what are the accessible apartments in my area, in my state, but you don't have internet access, you're also going to work, you just don't have the mental bandwidth to do it that day, contact a social worker at your nonprofit, meaning they have to already be working with you. Let them do it, right? That's one thing you do.
Yep.
Yeah. Now, so be leery. Takeaway here, be leery of a nonprofit that says you have to pay them a fee to work with them, but be open to, they might have some services that are fee-based if you have insurance, okay? And start with Amplitude Magazine as a database of all the nonprofits. Now, a question we commonly get asked, right, Emily, is do you work with other nonprofits? How do you answer that?
Yes, we do.
Absolutely. They should. If you are working with a nonprofit that says we don't work with other nonprofits, again, yeet yourself, to use the youngins' word. Get out of that area. We are always working together. You should work together. There is plenty of need to go around. We are a firm believer here at Amputee Aid that there's no such thing as competition in nonprofit world because there is limited amount of resources and lots of needs. So we should be pooling our resources. This also means, for example, it is okay to ask a nonprofit if they might work with another nonprofit to pay your bill. Right? We like to pay as many bills as we can, but if there's another agency that's like, we'll pay half if you pay half, good.
Yeah.
That's a good thing. You should never have a vibe where that's not allowed because from our perspective, right, Emily, that allows us to pay someone else's bill too.
Yeah.
It allows us to maximize our resources. So when you're working with a nonprofit, first, don't shy away from nonprofits. We don't ever want folks to feel like they're needy, right? Nonprofits are here for a resource. We want to help you. They all want to help you. And be open to maybe working with multiple if it means combining resources. Exception, try not to duplicate services. What is a duplication of services, Emily?
So if I were to ask someone to provide me with a wheelchair, but then I ask another place to provide that same wheelchair, well, you don't need two. So you don't want to make sure that you're only asking one place, or if you're going to ask both, then ask them to work together. Yeah. So you just don't want to, be asking different people for the same exact thing.
Yeah. So pooling money, good. Duplicating stuff, not good, okay? Don't get double free stuff, okay? So we don't want to duplicate services because then that really takes away from other people. Yeah. But it is completely okay to ask nonprofits to work together for your benefit, to pool resources to help you, and to talk with one another. Question, if you're comfortable putting in the chat, and then Lucho, you can let us know. Has anyone had a situation where, don't put the name in there, okay? Please don't out anyone or any agency, where there's been that weird competitive vibe, or like maybe you felt like you can only work with one nonprofit. Hopefully it's not yes and it was Amputee Aid. We don't ever want you all to feel that way. But I venture to guess, because I've heard this, that there is sometimes this weird competitive vibe. We want to assure you all, whether you're with us live or watching the recording, when you are working with nonprofits, that should never be the case. Okay, you should feel welcome to ask for help and welcome to ask them to work together. I see looking at us. Have we had people have that experience? Oh, does Kim want to say something? Kim, since
I do.
Girl,
I have
chime in.
That experience. I won't name names, but I have had that experience with a couple of, one with a nonprofit, not one with a person who is running what she would call a support group. But the problem is she wasn't qualified to do the type of support she was doing. And I am not comfortable with that. So you do have to, have discernment when you're thinking about, do I really want to work with these people? If they're saying I have to jump through hoops to get this one thing that I absolutely need, and I hate that I can't go anywhere else to get it. So you have to really use discernment in a lot of those. And I know there's a lot of competition between celebrity amputees also. Yeah. They're all trying to, make some money. I get it, but I wish they could see how coming together would be a plus, not a negative.
Yes.
But, yeah.
No.
Oh my gosh.
That's me.
Kim just summarized our entire theme for 2026. If you don't know what we're talking about, watch our recording from New Year's Eve and New Year's Day. Community stronger together. Absolutely right. We don't first when you're looking at a nonprofit. Although free stuff and free services is good, to use Kim's point, use discernment. Okay, free is not always better, and you really want to look for a nonprofit that has a reputation. You should interview the people who might be working for you. You want to know what their credentials are, that they're qualified to provide the services that they're providing. All really, really great points. Thank you for bringing that up, Kim. Before we go to, do we have any other comments, Lucho? Okay, before we go to tip 2, I want to point out something on tip 1, which is nonprofits and foundations. What the heck is the difference? Nonprofits generally provide more programs and services. Foundations are generally going to be looking at providing mini grants or help financially. Now, Amputee Aid does both. Okay, so that's the difference there. So when you're looking for resources, financial side, you might look for more foundations to apply for grants for example, Levitate Running Blades. There's a foundation that does that, right? Nonprofits, if you're looking for more of social services, healthcare navigation, your Medicaid, getting on insurance, those kinds of things, okay? So start with Amplitude Magazine to find free resources, including free services that in the for-profit world would cost several $100s per hour. Emily is free dollars, free 99, okay? Yes. Emily in the for-profit sector would be at least $150 an hour, okay? So there's that. That's one way of getting free stuff. But you're worth $1 million an hour, Emily, let me say, and more. All right, let's go to tip 2, and sorry for the formatting. Okay, Director Jennifer did this PowerPoint last minute. The formatting looks a little cray-cray. We're gonna, we'll fix that on the recording, and we'll tell you what it all says, okay? Tip 2, working with social service and needs-based agencies. First, Emily, as we're getting started with tip 2, what do we mean by needs-based and social service agencies? What is that?
So needs-based is they're kind of looking to see what all is it that you need. Last week we talked about Maslow's hierarchy of needs. Yeah. It's hard to develop friendships and relationships. You have to have that base things met. So we're talking about food, we're talking about housing, we're talking about the bare necessities to just live.
Yes. So. And these are things, again, I think there's commonly a feeling amongst the community that, I don't want to ask for help. Oh, I feel bad. It's uncomfortable. It's cringy, to use a kid's word. Please do your best to get those thoughts out, or at least compartmentalize. You can still feel that way, feel the feelings, but don't let that stop you from accessing resources that are there for you and that are available and that are a benefit for you, that you qualify for, and that us in the community service field want to give to you. One thing that we commonly say at Amputee Aid, not that this is a sales pitch for Amputee Aid, but one thing that we commonly say is, will you let us help you? You're not asking for help. We're offering help. We want to give it to you, right?
All you have to do is accept it.
Yes, just accept it. So try to, you can feel uncomfortable, but don't let that stop you from accessing these types of resources. So let's talk about what they are, and then we'll give you some tips, okay? First thing I said was the key thing. Qualify for.
Yeah.
This is also important for tip 1, nonprofits. Some nonprofits have specific criteria in order to qualify for their services. You might have to live in a certain area, have a certain income, have a certain type of insurance or no insurance at all. Some of them are open to everyone, like us here in Amputee Aid. So first thing to be aware of with nonprofits, but also these kinds of needs-based and social services, is there are going to be specific criteria for them. Now, since the formatting got a little bit crunched up for those of you watching live, we'll read them, we'll tell you what they are, okay? Food assistance, like SNAP or food pantries. This does not mean that you are failing. It means you are taking care of your dietary needs, right?
Yes.
So if you're looking to apply for food assistance to help you with the grocery side of things, again, freeing up the money that you were paying for something else, like your utility bills, your medical care, copay for your physical therapy, don't hesitate to apply for food benefits like SNAP, right, Emily?
Yeah.
Okay. And so that's something where a social worker could be very, very helpful, although each state has a website that you can apply. And sometimes you can even apply over the phone if you can't get to their main office. If you want to know more about food assistance, contact us. We'd be happy to help you find the agency in your state to help you apply. Similarly, housing assistance. There are all kinds of housing assistance programs, right, Emily? Some of them are short-term, long-term, 1 month, permanent supportive housing. There are very nuanced qualifications for these. If you're someone struggling to pay your rent, or you are, we say jokingly, couch surfing, but more respectfully, you are experiencing housing insecurity, please contact a nonprofit to explain to you what housing services are available in your area. Tip. We know this, a lot of people don't. Emily, what is coordinated entry?
So coordinated entry is where it's just one agency or one kind of database that everyone's using. So it's so that you don't have the duplication of services, or you don't have this agency, like places trying to determine, well, where should we give the funds, this agency or this agency? So it streamlines it all. It's one big list. You call, you get your name on the list. They do prioritize based on needs, but it's one big housing list instead of multiple lists with all kind of different agencies.
Yes. So in other words, if you are someone who's looking for housing assistance, whether it's generally not going to be mortgage, we're going to come to a footnote in a moment on mortgage. If you're looking for rental assistance, placement in an apartment complex, permanent supportive housing based on disability, these are all very specific terms that the government uses. You don't need to know whether you qualify right now, but if you want to know whether you qualify, you're going to look for an agency in your area, your city or your county, that participates in coordinated entry, okay? Key term, coordinated entry. Or sometimes it's referred to as the continuum of care, which is the group of nonprofits that work in coordinated entry, because that means you only got to ask one agency.
Yeah.
And when you ask that one, you go on the lists for all, okay? So that helps you because you're not spending days and days and days contacting a bunch of places and trying to get on all these different lists. It's one list, okay? And that's by federal law, okay? So that's not something that's unique to Pennsylvania. You'll find that everywhere, okay? Now, there's another type of assistance called what we call STRMU, STRMU, short-term rent, mortgage, and utility assistance. Now, this is for a specific demographic, but we put it on the list anyway because we want to make an important point about co-occurring conditions. Emily, what are co-occurring conditions?
Co-occurring conditions is that you have more than one condition or something going on that's both important. And so you've got two things going on, and so you can kind of put it together and in one bundle.
And maximize your potential to qualify for particular programs, right?
Yeah.
So, for example, STRMU, short-term rent, mortgage, and utility assistance, at this time under federal law applies to folks who are living with HIV. Okay, those folks have a special bucket of funding that they can apply for, such as help with utilities, help with mortgage, rent, and for a limited number of weeks. And that is in addition to other types of programs they might apply might apply to them. The point we're making here is that you can look at other opportunities that aren't specific maybe just to income or specific to your life as someone living with limb loss or limb difference. Look at your other resources. You might have age-based resources. You might have, as we're looking further down the list, intimate partner violence issues. You might have specific demographic issues, immigration type issues, where you would fall under the umbrella of other types of programs, right? Now, Emily, we also have mental health on this list. We've talked a lot about mental health at the end of 2025 and even the beginning of this year. And there are many programs where you could work with a mental health intern for virtually no dollars, free dollars, right?
Yeah.
Okay. And you, as a social worker, you had to go through a period of internship. Tell us about that.
So I did. I worked at a I worked at a private practice counseling agency, and I worked under someone who had the license. So I would have to kind of case conference with them. I'd have to let him know what I was working on, and he would also give me suggestions. But yeah, usually when you have interns, you're volunteering your time for. Mine was 6 months, and I did 2 of them. And so for that 6 months of time, I'm basically working for free. And that's but it's not free because it's going to my schooling. Like it's part of my schooling, and it just gives me experience and.
But if you're looking for mental health support and maybe your insurance doesn't cover it or the copays are not manageable, consider looking for a place that has interns. This does not mean second-rate, low-quality mental health services. In many ways, interns are top-notch because they're crossing all their T's and dotting all their I's, and they're getting the supervision and the follow-up, and they want to be extra careful.
And they shouldn't be burnt out yet because they're new.
They're not burnt out yet. They're fresh, right?
Fresh.
So you can look for things like that. Now, as we're going down the list, if you have worked with any of these organizations, these types of programs, and you're interested in sharing, let us know. We'd love to hear from you if you're watching us live, or you can put in the comments too. We're not asking you to out yourself. Some people don't feel comfortable doing that. But there's some other types of services that are available.
Just one more thing about mental health that I do know is that sometimes even if a place does require you to pay your copay or something like that, you can explain to them your financial situation, and they may be able to waive that copay for you.
Yes, so we're going to get to that in a minute.
They can do that.
We're going to get to that in a few tips here, negotiating your bill, right? The real savings. So we'll go along. We'll talk a little more of these commonly based resources that are available in every area. Okay, if you don't know what agency in your area provides these resources, let us know because we will find out very quickly for you.
Yeah.
If you are someone who is experiencing intimate partner violence, there's a full suite of resources: housing assistance, mental health services, legal support for folks who have current or prior history of intimate partner violence. So you want to look for those kinds of agencies. They're called victim services agencies that can help you, okay, irrespective of your medical condition. Healthcare navigation. If you're at the hospital, if you're working with your doctor and you need a referral, you're looking to get on insurance, they've got social workers, right, Emily?
Yes, I did do that. I actually shadowed someone at the hospital, and so they're and the nurses too. So the nurses kind of can be both. They can be a social worker and then a nurse too. But so you have social workers, you have nurses like that work on placement and things like that, and they're pretty much a go-to resource for anything that you need help with when you're there.
Don't do it on your own. Don't pay someone privately or pay your friend cash under the table to help you fill out your forms. Talk to your clinic, your doctor, the hospital that you're in, the facility you're living in. Who's your social worker? They're there to do that work. Let them do the healthcare navigation. Let them, for example, set up your medical transportation. Ask your city or county, what medical transportation do you have for me? Here in the Pittsburgh area, if you have a certain disability, you can get a free or reduced bus pass. So it's about asking, right? Right down to legal assistance. If you have a legal issue, look for your law colleges. Do they have pro bono clinics? Don't hesitate to ask lawyers. Do you do pro bono or what we call low bono cases, right? And also be mindful of certain demographic-based resources. If you come from a minority demographic, if you come from an African-American demographic, a Hispanic demographic, if you're undocumented, there are organizations that work specifically for you and provide a full suite of resources like support groups that Kim was alluding to, housing assistance, financial assistance, and connect you with other resources in your area. All you've got to do is ask, okay? So if you have any questions or comments about tip 2, now is your chance because we're going to switch to tip 3 in a moment here. Okay. I'm seeing none from Lucho, but he's watching the screen, so he'll let us know. Let's go to tip 3, okay, Emily?
Okay.
All right, tip 3. Da-da-da. How to negotiate your bill. Okay. As my grandma always said, the answer is always no unless you ask. Right?
Very true.
Okay, let's see. Lucho can tell us, thumbs up, hearts, smiley faces, something. How many people have a hard time asking to negotiate their bill? You know, I can remember before I became a professional fundraiser, somebody told me it was X dollars, like at the car dealership. I would just say, okay, take my money. Or can I give you more? Like the idea of asking somebody for a discount was like unnerving to me. True?
Yeah, because you think the price is the price.
Exactly.
But it's not always the price.
The price is the price they want you to pay.
Yeah.
Okay, not the price you have to pay. So the skill here is always ask. Always ask, right? Mm-hmm. Don't accept sticker value. But how do you do this, right? So there's a couple of tips that we have to share. One of which is don't be afraid to ask for discounts everywhere. This includes, I'm sorry to all of our clinic friends who watch us and join us some of the time, at your prosthetic clinic. Okay. We negotiate bills every day. Okay. So we know what happens. Ask. It's okay to ask, can I have a payment plan? Can you do a reduction? Right? What is the minimum that I have to pay? Can you waive this? Right? Prosthetic clinics, for example, are businesses. Some of that's a write-off. Some of it they can donate through a nonprofit and get a tax letter for that. So first tip is don't be afraid to ask. Okay. Second tip, for non-prosthetic related things, look at your benefits. I'm not there yet, but soon I will be a proud AARP card member carrier. Pretty soon, sooner than I would like. Use them, right? Use those benefits. Small savings everywhere amounts to big savings overall. So here's another thing with respect to your bills. For those of you who are insured, be mindful of when your co-insurance or your deductible renews, right? Can you tell us a little bit more about that, Emily?
So typically every year you have a certain deductible that you have to spend down, and then your insurance will start kicking in.
Yeah.
So that usually renews in January. So if you are, it might be beneficial for you to go ahead and pay something real quick before or have some type of procedure or make that appointment real quick before the new year, and then you'll have to start paying your deductible all over again.
Yes. So if you are at a time when you are due for a new prosthetic, but it's also the year that your kids are getting braces, right? You might want to structure some things out and plan on renewing something near the end of the year when you've already done your copay or your deductible, as opposed to the beginning of the year. We can help you with that, but also the navigators at your clinic can help you with that too, to make a wise decision as to when you're going to get your device based on when your deductible renews. This is also why we always want people. Most insurances will allow you to get socks and liners every 6 months. Please do that. Even if you don't need them, get them and store them, okay? Or give them to your friend who's also an amputee, because it's there. It's a benefit, right? So please do those things, okay? If you're coming up near the end of the year, you haven't used your health savings account, go buy all the ointments and Band-Aids and all kinds of things that you can. Give them away. We love people who give things away. Or stockpile them so that you're not losing your benefits. That is another way of getting free stuff, is to use the things that you were already entitled to. Okay?
And also remember that things that sometimes run out will renew at the end of the year. So like with physical therapy, you may only have certain number of sessions per year, but then boom, January, you should have a new number of sessions that you can use for that year. Mm-hmm. So sometimes the new year is not always a bad thing.
Right. Now we're going to give a secret tip maybe to our folks who are hanger patients. And I hope a hanger's okay with this. I know they are. We talk to them quite a bit. And before I get to this, I would love to know if you're willing to talk with us live, or you can put in the comments if anyone's actually negotiated their bill for their prosthetic, and if so, how it went. Was it successful? Was it not successful? Or what tips do you have? So if you're willing to share, please do. But again, we won't out anyone. If you want to share privately, you can send your email to us and we'll share it without putting your name when we send out our recording. But if you are a hanger patient, there is a thing called the Hanger Foundation. Anybody know about the Hanger Foundation? So the Hanger Foundation So if you had to be a hanger patient, they are a charitable foundation for hanger patients. And if you are struggling to pay your bill, you can ask for a mini grant through the Hanger Foundation. You do have to fill out some forms to do that, and you can ask for them to chip in a portion of your bill, and sometimes all of your bill, depending on your need. In addition to that, all clinics have hardship forms. They might not advertise them, okay, because they are a business. We love them all, but you can ask for a hardship form to fill out to ask to have your bill seriously negotiated so that you're having a more intelligent conversation as opposed to standing behind the counter and saying, what kind of a deal can you give me? Okay.
Yeah.
All right. So if you want to know more about the Hanger Foundation, let us know. We'll send you the information so you can read about it. You could also go on their website. They don't hide it. They advertise it, and they should. It's a proud thing that they do. They do a big fundraiser, and they want to give back to the community, and we love them for that. Lucho, any comments or questions that we should be mindful of? I'm seeing head shaking no, so that means we're answering everybody's questions, or everyone's just waiting for the Walmart gift card. I don't know which. Hopefully you're getting some takeaways from this. Let's go on to tip 4. Free stuff. Okay.
Good question, actually.
Yeah, go ahead.
Does that include bills that have already been sent to outside collection agencies that they're typically willing to negotiate?
Oh, great question. Okay, so I wish Phil, our lawyer from Edgar Snyder, was here because he could give you the legal, non-legal advice. Okay, so I'm going to give you my advice from the business perspective. Generally, the answer is no, because they have already sold that account to a collection agency. Okay, so somebody else already owns the debt. However, if it's their in-house collection agency, so they've hired someone to work for them in-house, the answer is yes. So you need to know first, where is the collection agency coming from? Is it a true third party that they've already sold the debt off? And by that, I mean that they have debt accounts that have not been paid. A collection agency will pay them a little bit of money and then go after the debt. Okay, and so now they own the debt. If that's the case, you're stuck with the collection agency. There are some ways to negotiate that. We'd be happy to help you with it because they're just looking to get some kind of money back. They're going to harass you, unfortunately, but there are some ways of negotiating with them. If it's in-house, this is true for any clinic, okay? If it's their collection, their accounting office, for example, then that's still negotiable and it's still something that would be eligible for a grant. Does that answer your question?
Yeah, that's perfect.
Okay.
Thank you.
And of course, you can always contact us too. We're happy to either help you or look at the financial side of things. Okay. Any other questions or comments on negotiating bills or Hanger Foundation? Okay. Lucho's saying no. So let's go on to tip 4, which is free stuff. Okay. So first thing is the Access Pass. Okay. If you've heard of the Access Pass, please let us know. And if you have one, I'd like to know how it went for you. The Access Pass is issued by the U.S. government, and it is a free pass for folks with certain disabilities. You do not have to be 100% disabled, but you do have to fill out paperwork and an application to get an Access Pass. And it allows you access to all recreational lands and national parks for free. Okay. You should, if you're considering getting an Access Pass, you're going to want to call the park that you might be considering going to make sure that it's still available to you before you fill out the application. It's not intense, but you've got to get some documentation and submit it. This is not something that you're going to do overnight. So if you're planning a vacation, give yourself plenty of lead time. But based on your medical condition, you can apply for an Access Pass to get free access to those parks. Okay, all of which should be, but many of which are, in fact, accessible and be a nice kind of incentive to you based on your medical condition, right?
Mm-hmm. Yeah.
Okay. Clinic supplies in surplus. When you are at your clinic, whether you go to a free health clinic, you go to a medical clinic like your doctor's office, or you go to your prosthetist's office, ask if they've got any samples. Ask, right? And there are some legalities behind how much they can give to you, okay, because we don't want to turn our clinics and our doctors into mini drug DEALERS. I'm not sure if I can say that on YouTube. Okay. They're not going to be hawking stuffed pills at you. But ask them if they've got any samples or supplies. Do they have extra socks, for example, that they can give you? Right? Can they give you a discount on their liners? Did a medical rep come through and leave them a special ointment and they can give you all the samples and packets? Ask for those things. It's okay to ask. And if you're not comfortable asking, ask your best friend, your partner who's with you, us, somebody to ask for you because they got stuff. They've all got stuff stockpiled or things that they're willing to give away because you're a patient, okay, including socks, all right? Yes, we have some comments. Go ahead. Whoever has a comment, let's hear from Lucho, or you can come off of mute.
Yeah, Kim is saying many museums have passes for those who are on government assistance.
Yes, museums, absolutely. That's another great point, Kim. So look locally for an area and see what is available to me as someone who's living with a disability. And if you're not sure to where to start, going back to tip 1, contact a nonprofit and they can do the digging for you. Great point, okay? We heard a lot during our New Year's Eve webinar about folks looking for outdoor activities and recreational use things and parks and stuff. So we wanted to throw in the access pass to kind of reference that. Do we have more comments, Lucho? Oh, Deb, yes, come off of mute and talk.
Thanks, Jennifer.
Sure.
Just 2 things. AARP.
Yes.
You do not have to be a member to do this, but they will do your taxes for absolutely free.
Ooh.
They will file it, and I've done it for many years.
Thank you for that.
They're set up at my local library. They're also set up at some churches. You go online, you type in AARP tax filing, and it'll direct you to a whole big thing that you can set up an appointment, and they do it for free.
Perfect.
Again, you don't have to be of a certain age. You don't have to be disabled, and you don't have to be a member.
Awesome. Get it. And this is the perfect time because it's becoming W-2 and 1099 season. Everyone wants to get their tax done. Look it up now. Deb, that's a wonderful point. Did you have a second point too?
Well, actually, another little thing that I do, Amazon, it's not, Amazon Prime, it's not that expensive, but I get it for half price because I was on Medicaid for a while.
Oh.
And if you are on some type of government assistance, you can fill out a form for Amazon Prime and you get it for half price.
I love that. I did not know that.
I didn't know that one either.
I pay $6.99.
Okay,
Wow.
Great tip. Okay, so we're going to definitely highlight those when we send out our recording. Y'all, if you're thinking of other things that you do for free, that's our last tip. So start thinking about those or putting them in the comments. Deb, thank you so much for that. I did not know about Amazon at all.
I didn't know that.
So we've got parks, we've got museums, we've got Amazon, we've got free tax filings. Get that money back, okay? We'll do our last tip here on tip 4, and then we're going to open it up to the floor, and then we'll close out with our preview of next week with Coach Jake and our Walmart gift card giveaway. Free samples. Okay. I say we don't talk about ourselves a lot. I talk about myself a lot.
I love
okay.
this story.
I am the queen of free samples. I have been a philanthropist and a fundraiser since I was a little kid. And I want to encourage all of you, do not give up on asking for free samples from companies. Let me just tell you. So when I was in, so this is in the mid 90s, we got our first desktop computer at my house. And back then you had to have dial-up internet with the EGGG, all the stuff. So the computer had to stay in my bedroom because that was where the second phone line was. And at night, when my parents were asleep, I would go on the internet because I could use the phone line. And I would go to all the businesses that gave you free samples. And I was like banking. I was getting free macaroni and cheese, free chapsticks, free feminine hygiene products, even though I didn't need them at the time, free magazines. I got stuck with all the CD samples for free. Like you got 12 for a penny. Remember that? Okay. Random House, I think. And I would, at the time, we would get home. My sister and I have a twin sister, if you didn't know that. I talk about her a lot. We would get home from school before my parents got home from work. So I would collect the stuff. Okay, like candy, Snickers. I got a bunch of Dole coupons for salad mixes, teas, hot chocolate, like everything. Okay, I would collect it and hoard it in my room because my parents wouldn't see it. The mail got there first. My sister and I got home from school, and then my parents would come home. And that was for like a good 8 months. And then I got caught. And I got caught because I got a case of Depends for my grandma for free. And when we got home, my mom was home early from work, and in our house was this gigantic case of Depends. And Mom wanted to know where it came from. And so I had to share that this whole time I was getting free stuff. I still do that, by the way. If you want to know how we do these giveaways, it's because every night I go on the internet still. I'm living my inner middle school child. Jenny is coming out, and I get free stuff. Don't hesitate. If you got a company that you like True Fruit, for example, which is frozen fruit. You like Dole for their bagged salads. You like Twining for tea. Email them. Tell them that you like them, and you will be surprised how many times you will get a coupon, a gift certificate, or free products in the mail. Don't give up on that, okay? Now, you're sending your mailing address out into the internet. So are you going to get spam email some of the time? Sure, but you know what? We do that already. We all get spam emails. We all get crap in the mail that we don't want.
And phone calls.
Don't put your phone number on there. Put your ex's phone number on there if they ask for a phone number. But don't hesitate to contact companies directly and ask for free things. If it's something big like a prosthetic, a wheelchair, a mobility aid, a liner, let the professionals do it. We're not as goofy as we are on the webinar. We are actually quite professional in our work life. We can do that. But if it's free little items, food, things that you like, ask. The answer is always no unless you ask. Okay.
And actually, just something I'd like to share. I just saw on the news recently where a kid wrote to cereal, like different brands, and literally pallets got delivered to his local food bank. So, I mean, sometimes a little ask you'll get way more than you even expected.
Yes, but don't hesitate. In fact, my challenge for all of you who are watching our recording or here with us live, this next week, contact 3 companies that you really like. And I'm interested to see how many of y'all get something for free. A coupon, even a discount code. Everything matters, right?
Yeah.
Or a product in the mail. Challenge yourself. Give yourself a half an hour, one night. That's all it's going to take. Go on the internet, send them a fan email, and say you'd like to have a sample and see what happens. You're going to be surprised. And some of you are going to come back and say, Jennifer was right. Okay. All right. Let's go on to tip 5, which is, what are your tips? We'd love to know if you've got comments. Lucho will read them, or you can come off of mute. We heard about museums from Kim. We heard a ton from them. AARP, those Amazon discounted memberships are super, super important. I outed myself as someone who still loves going on the internet and fangirling companies until they send us stuff for free. Emily, do you have any other tips, things that you...
So one thing, I'm sorry, I'm a social worker. So one thing I do know is that if you do get some type of government assistance, I believe SNAP or Medicaid, you can get phone service for free. If you've never asked for a free phone, I think if the first time you can get a free phone, but if you've already got your free phone, but you can at least get free service. And I mean, sometimes people pay $100, phone bills all the time. So why not try to get some free service? And I think she mentioned before, but there should at least be with your transportation, your local bus system. I believe if you have some type of disability or if your doctor will fill out a form, you can get your bus pass for 50% off. I'm trying to think what else. I'll think some more.
We'll share some more. When we send out the recording, we'll send some links to these different resources, information for how to contact us or how to look up housing assistance resources and things in your area as well. We'll send out the information for Access Pass if you're looking at that, as well as how to sign up for it.
LIHEAP, the Low Income Heat and Energy Assistance Program. So that can help you pay if you qualify. They'll give you a credit towards your bill, towards your heating bill. So that's always a good thing. That credit might help you for several months.
For sure. Lucho, do we have any other tips other than what we've already covered? I'm seeing Lucho shake his head no, which is totally fine. If you think of other tips, send them to us before Friday and we'll include them in our recording. We shared a lot of information, okay? It was like lots of stuff coming at you at once. We hope that at least a little bit of this was helpful, or that we at least got you starting to think about things like negotiating your bill, asking for supplies at your doctor's office, stockpiling those socks and liners and things that you can renew regularly with your insurance, getting those tax returns filed correctly on time for free, and start you thinking about those kinds of things, okay? Financial aid, for example, that you can apply for. And Kim, as she says, always ask. Some HMOs have financial aid. Yes, ask, always ask. And if you're not comfortable asking, reach out to us. Vocational rehab, yes. CJ, thank you for pointing that out. Vocational rehab agencies can help you with all or a portion of your upskilling, your degree. Thank you for pointing that out, CJ. I see Deb had her hand raised again. Did you want to share more, Deb?
again, I do.
Yeah.
Actually, I have to ask you something.
Okay, let's go.
Because you are a professional from birth, is it possible for you to share how you would word an email or a letter to a company asking for some samples?
Absolutely. I will send that out with y'all.
Yeah.
In a record in our email. I'll send it all to you, but just kind of I'll give you my key points are it should be 3 sentences or less, okay? Because you are getting the 3, maybe 4. You want to get the attention of someone very quickly. And you start out by introducing yourself. My name is Deb and I live in X. I won't say I know where you live. I won't tell everyone else on the internet where you live, okay? I have been a fan of your products for X years. And then the third thing would be your ask. But it has to be compelling to them. So you might say, I'm in a financial bind and I would really like to continue using your products. Could I have X? Okay. Or for me as a fundraiser, it would be, I have a client who would really benefit from using your services. Could we have X? Okay. So you introduce yourself, sentence 1. Sentence 2, how long have you been a fan? And if you've not, I'm not going to say lie because my grandma would come down from heaven and smack me in the face. You're going to flub it. You're going to, you're gonna flub it a little bit.
Or what you like about their
what
product.
you like. Yes.
What stands out to you about them.
Thank you. Do not lie. Okay. Do not flub. But make it appealing. So first sentence is about you. Second sentence is about them. Third sentence is your ask. And that should really be it. Okay. Don't send them a long letter. They won't read it. But I'll send you a template. Okay. And then we're going to get all kinds of free stuff. All right. All right. So thank you for asking that. What about resources for running your own business? Oh, Dr. Sue, great. So small business administration is a good place to start. Okay. Another great place to start would be your local chamber of commerce. Your local chamber of commerce will have seminars available for you, and they will be able to put you in contact with who your SBA resources are, who can do training for you, who can prepare your paperwork. So based on the type of business entity you want, some of that's going to be done in-house through the chamber. Some of it might be available on your state website, or in Pennsylvania, your Commonwealth website. Or a local legal clinic. So start with your Chamber of Commerce and ask them. And if you're not quite sure who your Chamber of Commerce is, we can find it for you. Usually it's based on the city or county you are in. Sometimes there's demographic. So if you are a women's Chamber of Commerce, Hispanic Chamber of Commerce, African American Chamber of Commerce, I would start with your location and Chamber of Commerce and ask them, what resources are there for starting my own business? And more importantly, what mentorship is available? Because you will find free mentorship with many of those chambers with people who have done the business setup and are working in a business who can guide you along that process. Okay. So great question. I'm glad that you asked that question. Go ahead.
And also, I forgot, this is the main one, 211. That's what they are here for. You call them up, you tell them what you're looking for, where you live, and they are the go-to resource to give you any agency in your area. So I believe it's 211. I knew it was 211 in California.
It is 211.
And it's 211 here in PA.
Yeah.
So I'm guessing it's 211 in any state.
It is.
Yeah.
It is because I work at a community center as a volunteer, and we have a huge list, and I tell people call the 211 because it'll take you to your local switchboard in your state, your county, your area, and you can also go on their website, which I think is 411info or 211info.org, something like that. But and then you can put in your city, state, and all that, and it'll pull up a whole list.
Yeah. And no ask is too small, or just, even if you think, even something that you would ask your neighbor, where would you get this, or where you can call them. I mean, that's what they're there for. That's what they get paid to do is answer the call and direct you to a resource.
Yes. So
I just found a resource for pantry. It's called pantryliteracy.org, and it's about how to create food pantries that are accessible in food deserts, that kind of thing, and what those food deserts really need versus what everybody thinks they need. So.
Great points, Kim. So, and we will, as I said, we will include as many of these resources in our email on Friday as possible. The last slide on our presentation before we closed out was our contact information, because at a minimum, we want the takeaway to be, call us if you need help finding a resource, okay? Or any nonprofit will help you find the resource. But the key takeaways I would like, in addition to that, is The answer is always no unless you ask, right? We saw a couple of comments that Kim always asks. Second, be creative, okay? It doesn't always have to be the free item. It could be a free service that frees up your ability to get services elsewhere or to use your money elsewhere. Always ask for samples, whether you're going to do the fangirl approach like me to all the businesses that you like, or when you're at your healthcare provider, what samples do they have? What items can they give to you? Use those insurance benefits when you have them. Stockpile the things that you're due for renewal on. Be mindful of when your deductibles renew. And look for community-based resources, whether it's the SBA, your coordinated entry system, your financial assistance programs, your needs-based programs. It might be hard to ask for help, but doing that can really inure to your benefit because it frees up your budget for other things, and it allows you to live a life based on what you qualify for, okay? So when in doubt, pick up the phone and call us or send us an email or even text us. Now, we're coming up to the end of our hour. So let me give you a preview for next week, and then we're going to draw a winner of our Walmart gift card. Is that okay, Emily?
Yep.
All right. So next week, we're back to talking about things that are more specific to folks with limb loss and limb difference with our special guest, Coach Jake from UFC Gym. We will be here in the studio in our workout clothes talking about adaptive and limb loss, limb difference friendly exercises. We opted to do this session at our studio. The last session we did, which there is a recording of, the video and the audio was not too good. So we're going to try it again here at our studio instead, and that is adaptive fitness with UFC Gym. So they'll be with us next week. The following week, we have Kim McClure here talking about body positivity and self-confidence and skincare therapy. And then into February, we've got a whole suite of things with some prosthetic clinics, your fitting appointments and what to expect for them. We've got special guests speaking. So lots of topics coming up. And we will get our 3D printing topic back on the agenda. Hopefully we did okay cobbling together this session in 12 hours. And I hope you all learned at least something or got some creative juices or maybe just laughed a little bit. But we're going to end with one of you winning a $50 gift card. I see some hearts going up. Thank you for that. Okay, so we took down everyone's name. Thank you, Lucho. Emily is going to draw the winner. She's not looking. And then she's going to read the winner for us.
Cammy.
Cammy. Okay, do we still have Cammy on here? Let's see. Okay, we still have Cammy. Okay, great. Congratulations. All right, so we are going to put your email address in the chat if you don't mind. I want to make sure that we've got it, and we will email you your gift card. It's an electronic gift card from Walmart for $50. We'll make sure that you get that. And y'all, because I said Jenny style, I get donations all the time. We will continue to do giveaways as frequently as we can. Hopefully they make you laugh a little bit, smile, and just make some of your time spent worth it. So thank you, everyone, for spending time with us today. We hope you learned. We hope it got you thinking a little bit. And we hope that you treat yourself well, okay? Take up my tip. Pick 3 companies, email them, and see if you can get a donation before next week. And please consider joining us next week when we have UFC Gym here. You're talking to us all about adaptive fitness for folks with limb loss and limb difference. Until next time, take care of yourselves. Have a great week and a great beginning of next week. And we'll see you next week, Wednesday, 2 o'clock Eastern Time, for another session of Life Amplified on Zoom and TikTok. Take care, everyone. Bye.